Hello, my name is Shaloo Choudhary, and I'm an occupational therapist. Today, I will be discussing the care of tracheostomy scar and swelling after the intubation. Now, before I start, just to let you know that this presentation is provided for the educational and information purposes only. Now, to begin with, let's talk about what is tracheostomy. So tracheostomy is a medical procedure where the surgeon creates an opening or cut on top of the layer of the skin of the neck to place a tube inside the neck for easier breathing in case of an emergency or a medical requirement. So right here where the surgeon do the cut to place the tube inside for the ease of breathing. We have seen this when people are recovering from COVID. We have seen this when somebody's undergoing a medical emergency or they're going through some surgical procedures. A lot of the oral cancer patients undergo tracheostomy, and then they have radiation on top of it. So we'll discuss that. So this is the tracheostomy scar. It's a cut on the neck under the vocal cords, and the breathing tube gets connected to the ventilator. So it's two-part. One part gets connected to the ventilator. The other part is here to allow the easier breathing. Now, know that the ventilator is temporary. As somebody recovers medically or surgically and the doctors decide they don't need the ventilator, they'll remove it. So the ventilator part is gone, but the tracheostomy, the surgery, that's permanent. When somebody recovers and do not need a ventilator, the tube is removed and the hole where the tube was inserted inside the body is, depending on what the surgeon's preference is, they'll either close it, they'll put sutures on it, or they would just allow it to heal naturally. So in any case, they would be left to heal. So when it is healing, that's when it creates a scar. So scar is essentially a natural way of wound healing. It's a mark which is left on the skin. Now, the scars, sometimes healing can take place between 4 to 5 weeks to 2 to 3 months, and the scar also heals from inside out. The other very distinct nature of the scar is that as it heals, it tends to shrink. But that's the scar healing nature. So some of the scars heal fine. Some just decide that, they're just gonna be in trouble. So some as they're healing, they become very tight, or they get sticky on the skin or soft tissue under. And sometimes their top area is raised as well. So some scars become very sensitive to touch or by close touching. So if a patient is trying to clean their neck or putting some lotion, it gets irritated, or they're putting some clothing or jewelry, like a chain on the neck, or maybe a polo neck or a collared shirt, so the scar gets very irritated. Some scars just hurt without even touching. So since this scar, which is an inside-out scar, is near the vocal cords, so in some cases where the scar becomes very sticky, especially if somebody has undergone radiation from oral cancer, then the patient has difficulty breathing, or they might have a difficulty in speaking loudly or projecting their voice. There's also a chance that some swelling is also appearing, inside and outside the windpipe. So different kind of scars. So I'm going to just show you. Oh, okay. So right here, this is a round scar, and you can see that. So the line is cut vertically. This is a horizontal scar, and they're looking pretty clean scar. This one you can see is a little bit like dent inside. This is another scar which obviously looks a little bit infected here. Not infected, kind of sticky here. I don't know if there was an infection before or not. And then you have a little rope-like structure here. You can see almost like where the tube has gone in. This is the scar, which is otherwise clean looking, but it has some raised surface. So scar treatment, what we can do. I mean, obviously, if something is bothering you for a long period of time, or you're just recovering from surgery, don't do anything till you get a medical clearance. But if something you have had this procedure done in a long while ago and it's bothering, make an appointment to see your surgeon. But in the meantime, you can start doing some scar massage, some very light, with very light, gentle hands. You can use an unscented lotion or a cold press oil, and you can massage around the scar. So if the scar is here, you can massage on top of it, bottom of it, side, and then maybe on top if the scar is not too sensitive. Then you can just tug and feel. If one area of the scar feels a little bit sticky, then you can massage it a little bit longer. Now, having said that, just know that the massage should not hurt. So if it's hurting, it means you have gone too much, too quicker, or too deeper. So adjust your angle, adjust your speed, but it should not hurt. And if you've done the treatment and you feel that it's becoming red or warm to touch, just call the doctor. So this is an example of the scar massage. This is going up and down exactly on the scar. This is going circles also. This is going up and down, and this is sideways. So change the direction of your hand. Now, this is the swelling example. So, this person has gone through some radiation treatment too. So we can see the skin is also discolored, and there probably some peeling or wounds from, or the burns from the radiation, and this has healed, and you can see a very obvious scarring which has happened. Now, swelling could be many reasons. Sometimes it's a healing swelling. So as the wound is healing, the body is sending extra fluid, which is a lymph fluid, to allow the body to heal. Sometimes there is a disease or a compromise with the lymph nodes or oral cancer treatment. So, so there could be many, many reasons for swelling. But in general, if there's some swelling which is around here, then you can address it lightly while you still seek some medical care. And the swelling is also outside, and sometimes in some cases where the complications arise, the swelling is inside the windpipe too. So that would appear when patients are having difficulty swallowing, speaking, or they just feel a little lump in their throat. So what do we do for the swelling? Same thing. You need to do a massage with a very, very gentle and light hand. You may or may not use lotion or oil. So you want to do the massage around here on the collarbone. So the direction of the flow of the massage should be out and about. It should not be here. The reason I'm saying it should not be here, because this is where the body's collecting area is. It's like the house, the water is going to go where the drain is. So this is where the low point is. So everything's going to stay a bit more here. This is also where the gravity is affected when we're using the phone or something. But, just know that the direction of the flow should be behind the neck, under the collarbones, maybe just put a little hand towards the armpit as well. And I cannot stress enough that the massage should be very, very gentle, and it should not hurt. This is the example of the thing, and this is where I would end my presentation. If you have any question, concern, or somebody needs a little bit more one-on-one training, just reach out to me on the virtual care portal, and I'll be able to help you. You can shoot me an email, or you can just call the site, and then we'll be able to help you with it. This is my contact information, and I will end the presentation here with the note that stay healthy, stay safe, and if you need help, we are here to help you.